The Motion Palpation Institute has changed in a number of ways over the years. We have added some new classes. We get questioned a lot about how many classes it takes to reach certification level, how many classes it takes to actually master the motion palpation technique. These are all great questions. The answer with that lies within each individual person and how quickly they pick up on material. But the fact of the matter is that with any technique and any new concept, it takes a number of repetitions to master the actual technique. It's just like a quarterback can't master a defense by seeing a defense one time, the same way you can't master a motion palpation class by seeing it only one time. The fact is that there are a lot of choices. There are a number of different continuing education classes that you can take. There are a number of certification classes that are out there. And why would you choose MPI over any of those other classes? You don't have to choose MPI over any of them. It's a great addition to all the other continuing education classes out there. However, what motion palpation has done in the past and is moving forward in the future is that we are combining soft tissue techniques with rehabilitative exercise and with dynamic assessment that is the core foundation of motion palpation. Our lower dynamic and upper dynamic movement assessment classes are a combination of soft tissue techniques, rehabilitation, and dynamic movement assessment combined with the motion palpation concept of dynamically assessing the spine and the extremity joints, along with the adjustive techniques that go along with that analysis. No other technique out there, no other institute is combining these things in a chiropractic-friendly way that makes you efficient and effective, not only from a patient results standpoint and from a patient orientation standpoint, but also from a financial standpoint. Many of the motion palpation techniques are geared towards the chiropractor to be efficient, not only from a patient volume standpoint, but from a patient results standpoint. And that's what motion palpation has changed and evolved into. So motion palpation has combined the core concept of dynamically assessing the spine and extremity joints with the dynamic movement assessment that combines soft tissue, rehabilitation, as well as the combination of those with palpation and adjusting, which is not often addressed in many other classes. The dynamic movement assessment classes, both upper and lower, are a combination of functional rehabilitation with soft tissue techniques combined with the core concepts of palpation and adjusting that motion palpation was built on. All of this leads to efficient and effective patient results-oriented practice, but also a very financially satisfying practice. All of which leads to a satisfying practice for you, the doctor, but also one that is not built on protocols, but on your findings from your functional assessments and from your motion palpation assessment. The combination of these two things, what you can see and dynamically assess with your eyes in the kinetic chain, with what you can feel and palpate throughout the kinetic chain with your hands, leads to a very satisfying and enriching practice that not only is results driven, but also financially stable. So why choose MPI? Because MPI continues to move forward and add evidence-based practices and new concepts and new techniques to its foundation, which has always been in palpation and adjusting, to find better and more improved ways to assess the kinetic system and to lead to better patient-oriented results. All of this leads to a highly satisfying, highly enriched practice that not only has happy patients, but also happy docs. So if you've never been to an MPI seminar before, come see the excitement and the passion that these courses can bring to your new journey in the chiropractic profession. If you're a student that has heard of MPI, we encourage you to come to our classes, to our core classes, the spine class and our extremity classes, to see the core concepts and how to become a dynamic assessor of joints of the spine and extremities. If you're a doc that's taken an MPI class in the past, but it's been a number of years, please attend one of the newer classes, one of our lower dynamic movement assessment classes or one of our master series classes, and see the difference that the instructors and their special areas of expertise have brought to the motion palpation concept, and see the difference that these new concepts and these new additions to our classes have brought to the MPI paradigm. If you haven't been to an MPI class in a number of years or are new to the MPI experience, I encourage you to come to our classes and experience the passion and the expertise that our instructors bring to our classes. You won't be disappointed, and you will most likely leave with a renewed passion and a renewed excitement about the profession and where the profession can take you as a doctor and where MPI can take the profession moving forward. Thank you.